Hello, everyone, and welcome to tonight's edition of the Berkeley Forum. My name is Cindy, and I'm currently the president of the organization. And tonight, we are pleased to welcome 4 fantastic speakers to speak on a panel on emergency response protocol. Before we begin, I'd love to shout out our 3 event managers for the evening, David, Oriana, and Sana, and first walk everyone through 2 brief forms we'd love to ask you to fill out. So if you are currently attending today's event, we would love for you to fill out our attendance form at the tiny URL on the screen, as well as submit any questions you have for our 4 speakers at the URL there. These links will also be posted in the event description as well as in the Facebook live stream. And without further ado, I will be passing along the event to our moderator for the evening, Noah.
Hi, everyone. As Cindy said, once again, thank you so much for coming to tonight's event. It's a panel discussing the emergency response protocol. The format of the event is going to be pretty simple. First, I'll introduce all 4 of our speakers, and after my introduction, I'll give them the chance to make some brief remarks introducing their positions and thoughts on the matter. And then after that, we will move into a moderated question and answer portion of the event. At the end, there'll be some time for audience questions. And just once again, we encourage you to go fill out that form to ask and submit any questions that you may have. So without further ado, we can introduce our first speaker for tonight, who is Chancellor Carol Crist. Now, Carol Crist is the 11th Chancellor and a former Executive Vice Chancellor and Provost of the University of California, Berkeley. She previously served as President of Smith College from 2002 to 2013. And before that, she was a professor of English and an administrator at Berkeley for more than 3 decades. Since her return to Berkeley, she has worked to foster community and improve the campus climate, strengthen Berkeley's financial position, address the campus housing shortage, and celebrate the institution's long-standing commitment to free speech. Chancellor Crist.
Good evening. Would you like me to answer the question now?
Yeah, if you just want to go ahead and give a quick introduction of your thoughts.
Sure, I'd be delighted to do that. I've had more experience with emergency response in the last 2.5 years than I had in my entire administrative career before that. We started with the fires in the fall of 2018. At that point, we had an emergency response management team. One of the things that I learned is that you have to meet every day, sometimes all day, every day, and you have to really choose the members of that group from the ones that are most relevant to whatever the nature of the emergency is. Communication is extraordinarily important. One of the things we learned is to have the chief of communications on this emergency response group. One of the things that we learned, our next set of emergencies were the power outages in a year ago this fall, in the fall of 2019. We learned there how important it was to concentrate on instructional resilience. And so we put together a task force on instructional resilience that worked really hard to try to make us more resilient to interruptions in our ability to teach face-to-face. And then finally, we had the pandemic to deal with. We had an elaborate set of groups that I appointed to deal with the pandemic on public health measures, on research, on instruction, on student support, on athletics, on residential life, on finance, on administration, on communication. And we brought those groups together at first twice a week, then now we're meeting once a week to make sure that we are in careful communication with each other. So communication is one of the most important things that we've learned.
Thank you so much, Chancellor. And our second speaker for tonight will be Guy Nicolette. Guy Nicolette is a medical doctor who came to University Health Services in February of 2019 with substantial experience in the leadership of university health programs, as well as in clinical care, teaching, and research. Prior to joining UHS, Guy served as the Director of Student Health at the University of Florida in Gainesville, a campus with over 55,000 students 16 academic colleges, and more than 150 research centers and institutes.
Thanks, Noah. I don't want to duplicate any of the Chancellor's comments, although I did live through hurricane seasons. We've never had multiple crises happen at once like we're experiencing now with COVID, plus wildfires, plus the looming specter of power outages. I think from the medical perspective, from the health perspective, what we have learned are a few things. One is that planning is invaluable, but plans are usually fairly useless after the first day. And so, you know, the importance of pandemic and epidemic planning has been further reinforced. And I think kind of pulling it all together with the situation on the ground is always the toughest part. Operationalizing that plan is very difficult, but we're learning a lot. And I think a couple of silver linings here are, one, we're learning more about how to plan for a large campus and to prepare for really the unpreparable things like a pandemic. Number two, I think we also have another silver lining in that this pandemic, because of the nature of the response, meaning we need to stay physically distant, we're offering a lot of remote activities. Well, the same thing in medical care and in counseling. We've had to learn how to deliver services and deliver care in a remote way. And the pandemic really twisted our arm to be able to do that very quickly. It probably didn't roll out the way we would have wanted, but we've learned a tremendous amount about providing medical, psychologic, social services, and other types of care, even urgent care, remotely through video or phone services. So I really think that is a silver lining of what we're doing now. And I think we'll be better served to take care of students moving forward remotely. We probably didn't take care of a population that was either remote or international or in another state as well as we can now. So I see that as a silver lining. I did, in doing my homework for this panel, I asked a few of our staff and physicians what they would say. And a lot of this really came down to us enhancing our already existing culture of including student leadership in protocols and in planning. And it was clear from the pandemic plan or the epidemic plan that existed that we hadn't done enough of that in the past. And so that's another lesson that we've learned. I think the other two things that the Chancellor touched on really briefly was that you know, we've learned that the financial impact of these things is not small, and we need to be prepared for that. We need to be prepared to be nimble and readjust and reallocate not only money but staffing really quickly to have a better adaptive response. Lastly, I think this pandemic has really highlighted the importance of technology, and it really serves as the backbone a lot of what we do, at least in medical care. And we really need to have a stronger infrastructure, a technological infrastructure, to be able to kind of flip the switch to go a bit more remote and offer remote services, even for your providers. So, you know, for instance, physicians, nurses, etc., psychological staff taking care of people from their home because they can't make it into work. So I'll stop there, but we continue to learn even through this pandemic, and I suspect tomorrow I will learn more, and the next week I will learn more. So maybe we check back then.
Thank you so much. Our third speaker then will be Lisa Vargas. Lisa is a PhD in psychology with over 20 years of experience managing health programs in health and human services, education, social justice, and systems reform. She has administered healthcare services for 10 years, first with the Alameda County Healthcare Services Agency, and currently as Director of Health, Housing, and Community Services within the City of Berkeley.
Good evening, everybody. Really happy to be here. What my brief bio does not say is that I am a Cal alum, go Bears. What a lot of people may not know about Berkeley is that Berkeley is unique in the state of California in that we are an independent local health jurisdiction. There are only two other cities than Berkeley that have that status, that is Pasadena and Long Beach. And what that means is that we are, for the most part, I'd say 90% independent of Alameda County around how we manage our public health system. We coordinate with Alameda County and we coordinate with all of the other Bay Area jurisdictions, but we do function as a county from that perspective. And so what that means in terms of COVID-19 and other diseases is that we are responsible for disease containment. We have a disease containment unit within our Office of the Director of Health, Housing, and Community Services, and they have been working very, very hard for the past several months around doing all of those things that you hear about: case investigation, contact tracing, outbreak management, and slowly but surely are managing that in an increasingly streamlined way. What we've learned in this journey has been that while it's very important to immediately respond to disease and do all the work around it required to contain it, that responsiveness also requires having a solid infrastructure and clear organizational structure so that everybody knows who's doing what, how they're doing what, assessing our progress, and continuing to improve. So we've really spent time the last 3 months really creating a COVID unit within the city that really is going to be a solid support for all of our disease containment as we move forward in the next months and years, whatever form that may take. The other thing that I believe that we are not always good at, but in this case we got good at pretty quickly, was increasing our collaboration with our local, other local governments. So for example, we are building a school-based COVID response team just for our local school district. But we've really been working extremely positively with Cal and in a really supportive, encouraging way together to manage this, both for UC students and community and the larger city at large. And then finally, I'll say that communication always from the outside seems faulty. On the inside, we always forget that we need to communicate more, more and more and better and better. And dropping everything and not really having that broader communication is a risk when people are afraid and they don't know what's happening and they need information about how they can be safe in society. And so really building and strengthening our communications infrastructure is something we aim to do going forward.
Great, thank you so much. And last but not least, our fourth speaker tonight will be Vice Chancellor Mark Fisher. Vice Chancellor Fisher directs efforts to improve campus operations to meet budgetary goals and aspirations. He addresses bringing campus technology infrastructure up to date and improving the campus's organizational culture, focusing especially on UC Berkeley's commitment to diversity.
Thanks, Noah. Just to add to things that have been said by the prior speakers, the Chancellor, Guy, and Lisa, one of the things I think I found about being at Berkeley is that Berkeley doesn't rest on its laurels. And each of these situations, whether it was a smoke event, the PSPS events last fall, or dealing with COVID-19, we've come out of each of these events learning something, improving our processes, and really thinking about how can we do this better. For example, last fall, we went through 2 of these power outages. We could have just said, wow, that's great, it's over with, let's move on. But we didn't do that, and especially working with the Academic Senate, there was a lot of thought put into how we might deliver academic content on the campus should this happen again. What we didn't realize was that COVID-19 would happen a few months later. But we were very benefited by the fact that there was a committee put together, a joint committee between the Senate and administration. They really looked hard at how we would deliver content. And so when we got to March and we decided to move into all remote content, the campus was uniquely prepared for that. We were in a much better position, I would say, than most of our sister campuses in terms of being able to move very quickly. In about 3 days, we moved from content being delivered in person to online content, and I think we did a pretty remarkable job. There's a term used a lot at Berkeley, it's pivoting. The campus is extraordinarily good at pivoting and moving in a new direction if it needs to. An extremely competent and dedicated group of people. The topics also this evening you have, dealing with other types of crises, whether it's protest or the smoke events, power outages, COVID-19. We have both a crisis management team and a protest management team on campus. We have a response management team that the Chancellor mentioned that's dealing with the aftermath, if you will, of COVID-19. All of these groups are extremely dedicated. Another, I think, great benefit of being on the Berkeley campus is senior leadership is extremely involved. It doesn't take much to get everybody in the room working on a situation for any number of hours it might take. So this is an amazing team, well prepared and very committed to working together and doing the right things for the campus. And to just add to Lisa, the city's been extremely beneficial and helpful to us through this process, dealing with health officials there. We owe a debt of gratitude to them in terms of thinking through with us what it means to have the campus closed, opened, variations on that. And we are extraordinarily thankful for their help over the last almost 7 months. So I think that's it. Thanks.
Thank you so much, all of you. Those were definitely great introductions, and we have a very esteemed panel today, I think I can say. Now, one thing I would like to take the time to remind everyone in the audience to do once again is just go ahead and fill out the question form if you do have any questions that you'd like to ask our speakers, and we'll do our best to get to them at the end of the panel today. Now, one theme that I think came up throughout all of those opening statements was this idea of collaboration being really important when it comes to planning for emergencies. Recently, Alameda County was one of the first counties to declare a shelter-in-place order, and that led to the need for a major reconfiguration of institutions all around the Bay, from UC Berkeley to beyond. So what I want to ask all of you is, beyond what you already discussed, what is the nature of collaboration between city government, public health officials, and educational institutions during an emergency situation like the one that we're experiencing right now? And we can start with Chancellor Crist if you have anything you'd like to add on that.
I actually would like to turn it over to Guy, because Guy is our most frequent and immediate contact with the city. We clearly work very closely with the city. We also work very closely with the other campuses in the system. So the chancellors of the University of California campuses meet at least once a week. During the beginning of the crisis, we were meeting every day. And we also work with state officials. So it's both collaboration on the local level with the public health department of the city of Berkeley, but also collaboration with the state and collaboration with the other UC campuses.
Well, the Chancellor said it perfectly. I don't have a whole lot to add other than the Berkeley public health official and our medical team, Dr. Anna Hart and myself, meet on a regular basis, weekly, and are in, we'll say, constant contact with one another about as issues arise. And we've just had a really, really great relationship. I think bidirectionally, we have different views on the situation, and different perspectives is probably the different a better way to say it. But we've really been in alignment, medically speaking, epidemiologically speaking, throughout this. And we view this again, at least from the medical side, we view this as, you know, the campus is really a part of the community, and the community impact on the campus is real. And so we're only a rising tide only, you know, raises both ships. We really have worked hard to figure out ways that really minimize transmission, mitigate outbreaks, and what that takes is regular, constant communication. And in our case, we're lucky that, you know, it really is transparent and from a true public health mindset. And I've really enjoyed that with Lisa. So I'll stop there. I don't know if Lisa W. has anything to add to that.
So to add confusion to the system, the health officer of the city of Berkeley's name is Lisa Hernandez. So it's, I think it was Dr. Hernandez that Guy was referring to there. But I can tell you that Dr. Hernandez, also a Cal alum in her own right, has really dedicated a lot of time, energy, and support along with the university. And I just think it's a very mutual relationship. I can share some of the specific things that we've worked on together around the public health response. Well, I'll start by saying the city and UC have always collaborated on communicable diseases such as tuberculosis and measles. And believe it or not, in that pandemic, these diseases still exist, and we do continue to also contain them and to work together to solve issues related to them. But some ways that we've worked together is we've worked together to support the workflow at the Tang Medical Center to aid with contact tracing. We've partnered with University Health Services and staff for off-campus cases and outbreaks to perform case investigation, contact tracing, and provide education and outreach to students. We've worked with the campus leadership on providing guidance on safe occupancy and other COVID precautions for university-affiliated housing, such as the International House and co-ops. We've worked with the IGI lab, who's provided testing for 5,000 individuals, many of which are City of Berkeley residents. And through the IGI lab, I can say the city is profoundly grateful that we were able to get our testing up and running, and now is testing well over and above what the state or any public health experts recommend. And we continue to work with the UC emergency manager to coordinate the response and provide resources such as PPE through resource requests to the Emergency Operations Center. So those are really concrete partnerships that I think are contributing to a relatively, compared to our neighbors, sort of supportive disease response to date. So, yeah.
No, if I might add to that, if you look at the numbers, the level of infection in the community of Berkeley and the campus, the numbers are pretty good. And I think it's this collaboration across the city and the campus and county and our sister campuses too as well. I think that's made us, I'm going to be careful here, relatively successful in terms of response to this what could have been a huge health crisis.
Yeah, of course. Anyone have anything else you'd like to add? All right, well, one other kind of thing that was mentioned on that note, I think it was by Chancellor Crist, and the first response to that question was how, well, local health officials are certainly important. There also is that aspect of collaboration with officials at the state and federal government. So from that perspective, how, if at all, could changes, maybe from a public policy standpoint, be made at the state and federal level to make your job of emergency response be easier going forward?
Oh boy, that is a big question and a hard question. I don't think I'm speaking out of school to say I don't think the federal response has been coordinated or strategic, and it's made it very hard for the states, because I think each of the states feels that it's basically on its own, figuring it out. that we don't have a national mask policy, for example, that we don't have a coordinated testing policy, that we're not, and I'm speaking nationally testing as much as we should, are huge problems. The United States is, I don't think it has the highest death rate in the world from COVID, but I think it's the third highest, I think after India and Brazil, if I'm remembering rightly. And that's not anything we should be proud of. That's really deeply troubling, and there's so many lives lost. We're at 200,000 lives lost, I think today, I saw in the news. So, and I really do think there have been failures of national policy.
Let me just jump in here and say that I think there's a lot that we could kind of dissect about you know, the state response and federal response, but I'll focus on something that I think not many people thought of, and it really could dramatically affect the future moving forward, is at the federal level, figuring out how to have state reciprocity for care. So for instance, if you happen to be a Cal student that lives in Nevada, I'm making that up because I'm not sure about our reciprocity laws with Nevada, but there are certain states for which we cannot see patients under our current licensure system. And that sounds antiquated and hard. It's frankly hard to swallow as a provider, or I'm sure as a client or a patient, that you can't see your doctor or your counselor because they happen to live in another state in the year 2020. So again, I think there's the bigger picture is that these kinds of situations, these epidemics and pandemics, really do, it is a national and a global crisis, and it highlights the weak links in the chain of national and global response to these, and national and global community that we really have become. So I'll point to that, and there's a lot more we could say.
So I will add to that. I didn't even know that about the state licensure issue. So thank you for teaching me that. What I'll say is what this pandemic has also highlighted is that some of the societal challenges that we have, our politics, our polarization, the political pressures that sort of always manage to weigh in on our various decision making, have really come into play in the public health realm. I don't know, public health officers have been beaten, they have been bribed, they have been, you know, manipulated in all sorts of ways. And it is very, very hard to stand in the heels and really stand your ground on what you know is going to be a required public health response. On the state level, well, you'll remember here that when our 7 Bay Area health officers came together and created the first shelter-in-place order in California, that was a huge undertaking, that they had that infrastructure for collaboration locally, which is rare, which, by the way, came out of the AIDS response in the 80s. That collaboration muscle built out of that was amazing. And then it was followed several days later by the governor's same shelter-in-place all-state order. But as those weeks ticked on and business and the economy started to sink, and people with, you know, money or social networks started to, you know, have their word and say, the state ended up relaxing very early and fast and sort of caving to some of those pressures. And what we found was what was initially a good response suddenly backfired, and suddenly California was one of the highest infection rates in the country. We learned from that. We've backpedaled and backed up, and now we have a new blueprint for a safer economy, and there are stricter guidelines. But just the awareness of how much politics plays into how we respond and how we as a society come together in support of each other's health. It's been very startling through this pandemic.
No, if I could just add one more thing, I don't mean to cut Mark off if he had something to say, but we've mentioned in the past how engaged our senior leadership is, and I want to point to one specific example. And I find myself often referring to the CDC guidelines and to CDC because that's been the national kind of repository for guidance around infectious disease, amongst many other things. That said, when they came out recently with guidance about asymptomatic testing, it might have been easy to just say, well, you know, the CDC is kind of recommending against this, but we as a campus felt so strongly that asymptomatic testing was a part of what we not only could do but should do, and the Chancellor and campus leadership were in complete support of that, even though it went against a current CDC guideline. Oops, sorry, my computer got dark. So I guess this is just an example that, you know, I'm very proud to be at Berkeley, where we can kind of have independent thought, and when we don't think something is right, you know, we have shown the ability to kind of step outside of you know, even national guidance. And if you look in the past week, they have now reversed their thinking on that asymptomatic testing. So I just wanted to make that point.
Maybe one last thought. So the federal government certainly has been slow or non-responsive in terms of testing and contact tracing. But I actually think, while the state, to Lisa's point, did a lot of great things at the beginning, I do think this is an area still that seems pretty weak to me. Just, you know, good guidance, or for example, these testing companies like Abbott are coming out with products. The state of California really should be pushing heavily into this and helping us, you know, provide these tests and these materials. And, you know, we should be a leader in this area. The state of California should be a leader in this area. And they really should just be full court press to see if these materials can't be made as, you know, available as quickly as possible, especially the universities, where we know the virus has a tendency to grow and spread pretty quickly. So anyway, just my thoughts on the state.
Yeah, thank you so much. So one thing I think you all kind of touched on is how information and having the right information can be really important to, you know, planning out a response. But when concerns about COVID-19 were first emerging, there was obviously little to no research on the virus, which I would assume made it difficult for institutions to determine the right course of action. So given limited information during a crisis, how, if at all, do you go about determining when to release orders and what those orders should be?
That's a great question, Noah. I've been so impressed, awed, and grateful for the generosity of our faculty. So Berkeley being Berkeley, we have world experts on epidemiology, on on epidemics. And we had examples of faculty members who changed the whole focus of their research program to focus on COVID. And what we did as a leadership team is really brought those faculty into our decision-making process. And Guy has been extraordinarily important with his medical expertise. So when there is a new and emerging phenomenon that isn't understood very well, the most important thing is to go to scientists, to go to experts, and find out what they think and act on their advice. So that's why I stood up very early on in the pandemic a public health and testing advisory committee. Nick Jules, a professor of biostatistics, was the chair of that committee. They gave us advice and we followed it, and it was much more conservative than the advice that other campuses were following. But I think in retrospect, it was proved right.
I think we were tracking this virus earlier than some campuses too. We really started talking about it in, I think, late December, January and February. We were really, we knew what was going on in the US and a good sense of what was going on in China. And we're really watching very carefully with the notion that this would come here eventually and would impact us.
And I think to a larger, kind of a little bit of the larger question is how do you make decisions with limited information? And I don't have all the answers for that one, but I think, folks in these positions need to be pretty comfortable. I mean, I think that's a bit of a skill, and it's a bit of, some experience to understand that we don't have all the evidence. And certainly sitting here today, we are still lacking quite a bit of evidence about this virus. But yet decisions do have to be made. And I have pointed this out to a number of folks over the past few months that, I think one of the better things that we've done as a campus is evaluate a particular point of view, a decision, try to get as much opinion as we can from everyone, from experts, and as Carol said, we've got lots of people that we can tap on that have both international, national expertise in a given field, and weigh the decision carefully, and then make a decision knowing that the evidence might lead us in a different direction, and we will adapt to that new evidence. It's just a system, an iterative process of decision making that really it has to happen in this kind of situation. And frankly, any kind of large crisis, in my opinion, kind of revolves around the ability to make those decisions and then reverse a decision you make or adapt a decision that you make. I'll stop.
Well, on a practical level, I'll add two things that we in the city, I think, have been hammering home. The first is the very basic, simple message of how to stay safe and how to protect yourself and others, right? Wash your hands, wear your mask, maintain social or physical distance, and be within a social bubble. We know those things work. We've seen it across the world in places where that's happened. It works. It sounds very simple for some people, and it is. It is actually that simple in theory. Now, when it comes down to asking people to hunker down and shelter in place for 6 months and upwards, it becomes psychologically more challenging. So we can all talk about how simple it is. We know it works, and we all have to continue to commit to it, even if it is, increasingly difficult and holidays are coming up and whatnot. The second area of focus that we really focused on from the get-go is health equity. And we know that in Berkeley, health disparities are very real. We know that African Americans, Indigenous peoples, and other people of color are way more likely to have poorer outcomes than, for example, white people. We knew before COVID came here that when COVID came here, it would impact people differently based on race. And so we implemented a variety of strategies early on to help support our people of color in the community. One of them was mobile testing. We have consistently done testing in partnership with the lab at UC Berkeley, with bringing testing available to essential workers, to the Latino community, to the Multicultural Institute, to skilled nursing facilities that have higher numbers of people of colors that work there and where risks are higher. We remain committed very much to continuing to address these disparities that we know are going to impact people differently.
Great, thank you so much. And I think that touches on, a really kind of essential point. So maybe throw it back to you, Dr. Vargas. One thing I would ask is, what challenges, if any, exist in getting testing and other, vital resources to people who are living in maybe unstable living conditions, or, have recently had some kind of an issue that makes it hard for them to get access to those resources?
I think the biggest Well, testing is an ongoing challenge. Costs are coming down. It's costly. The market is adjusting itself. That is one thing. That is also something we can work with. The biggest challenge is that people are also differentially affected by a shelter-at-home order. Many people in Berkeley can actually shelter in place. They can stay home. They have my husband is a college professor. He's left the house like 8 times in the last 6 months. Other people have to go to their jobs. Their jobs by nature don't necessarily offer, distancing opportunities. They may be more impacted with people, and there's a fear of losing work if you don't go to work. So this about, oh, don't go to work when you feel sick, that is a privilege for many of us, although we need to make it a reality for all of us. And so what we're finding in some communities is that even when we do the education, we do the testing, when we then follow up with case investigation and contact tracing, we find that people know they may have.
I think your microphone might have just muted itself.
Oh, technically,
okay.
I got muted by the host by mistake, and then I didn't realize I could control it. Sorry. Part of the challenge that we're having is and that's not a blame issue. That's a life issue. You have a choice between staying home or feeding your family or paying your rent. Those are real life choices that people make, and it has led to some stigma in communities around COVID, and it has led to sort of a lack of ability to contact or to follow up on contacts. So one of the things we're doing to address that is developing an education campaign in multiple languages, looking at identifying pools of resources where we can offer people some basic needs funding. The city has started with a $125,000 basic needs funding stream specifically for undocumented individuals who may fall ill or need support under COVID. And really looking to do some wraparound supports and recognize and acknowledge that not everybody can shelter in place, and we know that not everybody's going to do that.
Great, and then obviously Berkeley has over 30,000 students as part of the university, and that means that there are students in all different types of living conditions. So maybe for those of you here representing UC Berkeley, could you talk about a little bit about how those factors might play into the emergency response, particularly in relationship to a pandemic?
Yeah, that's a great question, Noah. That we're first of all, we prioritized. Both the state and the city of Berkeley wanted us just to have single occupancy in the dorms. And so what we prioritized for dorm rooms were students that really had an urgent need for dormitory housing, former foster youth, homeless students, students whose home situations really didn't, have good conditions for studying. And what we've also tried to do is apply an equity lens in our delivery of instruction, so that we have students all over the world, and it may be a great time for us right now here in Berkeley, but it may not be a great time in China or in India. And so we're trying to do our best to guarantee asynchronous instruction for our students.
I'll just jump in and say, from a bit of a real life perspective, a lot of the things that Lisa mentioned obviously impact Berkeley students. And we've got, we represent a lot of the same communities within our student faculty and staff population. And there are some real challenges. One of the communities that we spend a lot of time thinking about working towards is a group that live in apartments a mile away from campus. And so that doesn't sound like a lot, but even just transportation back and forth to the campus for things like testing, or if they need confirmatory tests or even other medical care, it's become a real challenge. And as Lisa mentioned, it is more likely that those folks can't take time off of work, need to support their kids, have kids learning from home themselves. And so there are certainly a lot of parenting students that, you know, are in, you know, a very, very difficult situation. And as Lisa said, it's that there's not much choice about it. And that they really do, you know, we really, there is a moral imperative to support those folks.
Try to make sure that especially that portion of our campus population that might be most vulnerable, and I'm thinking about custodians and those that come in and clean buildings and make sure that we could stay operational. We tried to put all the safeguards in place that we could, whether that was proper PPE or making sure the buildings are signed in a way so that those moving through the buildings know the patterns they're supposed to use. We actually have some review of those who are in the buildings to make sure they're following the rules in the buildings, so that if it's a laboratory that's up and operational, there are teams that go through to make sure that, again, proper PPE is being used in the labs, that the spacing between the work on the benches is adequate. So, and that was done in large part to protect the very workers Lisa was talking about, those that have to come to work. Their work can't be done from home. They probably have families at home, many of them. And we wanted to make sure that to the extent possible, we were providing all the safeguards for that particular part of our population possible. We've seen very low incidence, and Guy can address this, of infection in the research community on the campus and our staff on the campus. So I think those tools have been effective. Also, frankly, not having students in classes in the buildings this fall helped. I mean, it's you know, we've kept the population very slim on the campus through this part of the fall, at least.
I might add that what we also did is we extended the testing protocol that we decided on for the dorms, which is 2 tests a week, to what we call congregate living, co-ops, fraternities, sororities. At Bowles Hall, we didn't have to do that, but we thought it was really, really important to have the same testing protocols in dormitory-like situations that the university didn't control, wasn't our property.
And Noah, one other thing that I would add, a little bit of a tangent, but I think one of the things that we've learned, or learned the hard way in some cases, is that particularly for faculty and staff, but also for students, that childcare during these events is just incredibly important. In fact, it likely determined some of the success and some of the failure in certain areas, because you know, if you don't have childcare, again, it's just not it's difficult to even call it a choice, to either support your child or your children, or to, you know, to not. And so even in healthcare, you know, we were critically low on staff at various times during this because of a lack of childcare, and because of the way this spread out. And again, I'm not trying to, this is not a blaming you know, perspective. It's just it's the reality of the situation. And so I think what I've taken from this is part of crisis planning, emergency planning, pandemic planning has got to address childcare, and how we can really start from the start addressing that.
To that point, we recently expanded our dependent care, sort of emergency dependent care, and also their programs on campus through rec sports for families that have perhaps a student that there's no one at home to tutor, or to make sure they're doing their schoolwork, so they can actually join those programs on campus and have support through a cohort-based support group.
Yeah, great. And now, in terms of reaching out to and working with students, university officials in particular have explored a lot of methods other than just emails and text to communicate with students during the pandemic. For instance, Chancellor Crist held a Reddit AMA, that stands for Ask Me Anything If You Don't Know. And so essentially the question is, how, if at all, are officials both on the university level and the city level planning to communicate with students in more non-traditional ways going forward if another emergency situation were to arise.
Yeah, we actually have planned another Reddit AMA. So we want to, reach students in as many ways as we can. We were talking today, I was talking with the student government about doing, I think this is an unfortunate way of describing it, fireside chats. So maybe we would do, we were talking about tea with the chancellor. I don't know if students drink tea, but anyway. But I'm really trying to find lots of different ways of communicating with students and reaching out to students. One of the things I've been so pleased by is that students have been using social media to try to help enforce social norms. And I think that that's really great.
And then Dr. Vargas, maybe did you have anything from your perspective on that?
That was really interesting. I was in a meeting today where we were just talking about how the students at Cal are really starting to, I guess, step up in terms of like calling out their peers when they're not wearing facial coverings. And I mean, I just think that the message that, hey, if we're gonna open up, then we actually, and if we want more of our other fellow students and classmates to come back, then we really have to actually follow these rules. So I think that's wonderful. It's always supporting the students and using the media, Facebook and Instagram and all those things. And though let's try to be nice about it. So I mean, I think that our primary strategy in terms of Cal students is to work more closely with the university itself, because I think that many students, even if they're living from Berkeley, they're very connected with the university. So I think that, one of the things we try to do in staying in communication is so that, core messages get out in the student community. We have done some more I would say aggressive sort of signage up near certain areas of the entire city where we may have seen a little more social activity than otherwise. The mayor has a new campaign now called Mask On to Move On, where he's trying to get that through the community. And so, I mean, targeting areas where we may see more activity than other places is definitely also another strategy. And I think that one of the things city government just needs to get better at is using like modern social media instead of saying, go to our website, go to our website, go to our website, because nobody does that. That's an area where I think we could do some work ourselves.
No, it's a great question. I think from my perspective, we have social media accounts and use them probably a little bit with moderate effectiveness, and we could really improve our utilization to get these messages out. I was going to advocate to Mark. I heard that TikTok was for sale, and so I was thinking that campus could but we could we could centralize the messaging better. I think the Berkeley app is now starting to get to the point where it has a lot of useful functions and might even be able to get some of this messaging out around our social norms campaign, Bears Protect Bears, and really kind of link into the ways that people consume information and look for information in a better, more integrated way, because otherwise we spend so much time trying to find the latest platform and get up to speed on delivering messages in the language of that platform that we're always a little bit behind. So part of the answer, I think, is listening to you, listening to students on how they want to consume this information, and quickly getting that information out, hopefully driven in large part by students. And that's what we're trying to do here, is engage students to kind of create, craft, and we'll serve as advisors to that messaging.
One of my favorite low-tech things on campus is the communications group had custom face coverings made for the bear sculptures on campus. And then they painted on the ground what a 6-foot dimension looks like away from the sculpture. So I think those sort of clever graphic ways of communicating sometimes are both fun and also fairly effective.
Right, and I think that I have time to ask one more question, and then we can move into some questions coming from those in our virtual audience tonight. Now this one, it is a little bit more geared toward the UC Berkeley officials, but anyone can feel free to jump in on this. During the pandemic, most educational institutions, including of course UC Berkeley, rapidly switched to virtual learning in March 2020. And many, including once again UC Berkeley, have continued that virtual learning into the fall. So how, if at all, have lessons from the switch informed plans to respond to academic disruptions in the future?
That's a great question, and it's something we think a lot about. When we moved to remote instruction in the spring, the faculty had 2 days notice, so it was really done on the fly. But what we did during the summer is we devoted a lot of resources to trying to create the virtual courses in the fall to represent best practices. So we gave 300 fellowships to graduate student GSIs working with faculty members to switch their fall courses to remote form. We created a set of over 30 courses called required courses, gateway courses, frequently taken courses called Semester in the Cloud. About 2/3 of our faculty, about 1,000 faculty, took a set of workshops over the summer in best practices in remote teaching. We have a website for faculty that has lots of tools on it. So we're really trying to provide all the opportunities we can for faculty to do this as well as we can. And some faculty have been saying, boy, it's like I discovered a muscle I didn't even know I had. So I hope we're gonna keep those the fruits of those lessons with us. We're going to learn a lot this semester. It's one of the ways in which students can really help us is you're telling us what's working and what isn't working. This is new learning for all of us. This is an unprecedented situation, and you can really help us in telling us what we need to do better.
As we think about the future, we think about the nature of our academic spaces, and do we really need large classrooms, or is this a model that you can use to teach a large course rather than building a 1,000-seat auditorium, which eats up a lot of real estate on the campus? This might be a good alternative for us. So as we're in the middle of developing plans for a couple of large buildings on the campus, this is very much part of the conversation. What have we learned over the last year, and how do we use it moving forward?
I think the same things. I'll just echo what the Chancellor and Mark had said, that we had a little bit of a head start on the clinical and the medical and psychological counseling side. We had already offered to some extent remote care, but this has really forced our hand to really think deeply how to do it on a bigger scale, and it would help us tremendously to have ongoing student feedback about how we're performing, how their care is perceived and delivered remotely, how things like drop-in sessions work, and crisis counseling, and all of the not only services we offer but the care we offer, because we need to learn a lot. This is not I don't believe we're going to wake up on January 1 and suddenly things will have been like a dream and we're all the way back to where we were before the pandemic. This is a transformative change, and we're trying to transform along with it, not only in our care models but in all of the things that we do, and spatialization too, like Mark said.
And for our work environment, a lot of our staff, I think, when this is over someday, they're going to opt to work from home some number of days per week. This also helps us both from a space utilization standpoint, but also I think it gives people more options for how they manage their life. It helps with traffic, the density in and around the campus. I think we're learning an awful lot through this process. It's going to be very beneficial for our future.
Well, thank you so much, guys, for answering my questions. But of course, we have some questions from our audience here tonight. And once again, if you're watching this live stream and you're hearing all of these questions come in and you think, well, I have a question that I want to ask, feel free to go over to the questions form. It's pinned in the Facebook chat, and submit any questions that you might have. So without further ado, I guess we can get into our first audience question tonight. It comes from Ling, who is in the audience and asks, what emergencies do you now have to prepare for, given how rapidly California is changing?
That's a great question. I still remember the Oakland Hills fire, when we had a terrible fire, destroyed 2,000 homes in the Oakland Hills. We always have to be worried not just about the smoke from more distant fires, but fire actually here. And then, of course, earthquake is the big emergency that we're all both fearing and need to be preparing for.
We have a whole stack of potential crises that we think about, train for, and to the Chancellor's point, we're about to have a tabletop exercise with the city and the lab regarding a fire. If a fire swept down the hill through the lab and into the campus, what might that mean for us? And our friends at UC Santa Cruz have been through this recently, so it became very real for them what it means to have to truly close a campus. We always say we never close, but in their case, they were down to, as I understand it, one faculty member and their police force. And our training will be around a similar situation where we really have to think about how do you evacuate the campus, both the laboratory, the campus, the impacts on the city, but also what does that mean operationally to have the campus truly shut down.
And I'll add to the list that Chancellor Crist named. We are also in the city of Berkeley pondering the potential for political unrest with the upcoming presidential election and with Berkeley's reputation for its politics and the people that it may draw and potential rioting. So we are also very mindful of that, having just come out of that earlier in the spring.
And I guess kind of on a related note, we have another question from Jack, which is, what have been the challenges of dealing with intersecting crises, especially relating to wildfires, the pandemic, and the continuing financial impact of the economic crisis?
Well, I can jump in on that one, at least medically. Oh, sorry to cut you off, Mark.
No, go ahead, Nick.
Yeah, so one example of many that really has given us a quandary is that for respiratory infectious disease, the best one of the better responses is frankly outside air and being outdoors. You're typically at less risk of transmission and less risk to catch disease in outdoors. Things spread more easily. However, in fire and smoke, it's not advisable to be indoors, and in fact, having good ventilation and filtration systems that filter out that particulate matter is important. And so the campus made the, in my opinion, correct decision to try to switch as many buildings when COVID hit to outdoor air to not recirculate the virus. And unfortunately, then smoke and wildfire hit, and it's challenging to reconfigure these buildings in that way. And so we've really had to struggle, even with our testing, which was outdoors, to try to find the right sweet spot to keep people somewhat safe from terrible air quality, but at the same time respecting that the virus likes indoor and recirculation.
I was going to say the exact same thing. It's been interesting to have, one set of solutions then completely complicated by a new set of conditions.
Yeah.
I knew I should have let you answer. You'd have been more eloquent than I.
Well, I'll add to the from a different angle, which I 100% agree, and we have had a very similar experience in the city around the pandemic versus the fire. But I'll also add that earlier in the year, we were managing both the health pandemic. We were basically managing the competition between two fundamental American rights, the right to good health and the right to protest. And so trying to also navigate like understanding that people were upset, they were angry, they had lost work, they had lost a lot, and they were not staying at home when they felt things were unfair. So really trying to balance the messaging with a health officer order that was not about being able to be large gatherings outside, but just sort of balancing between still allowing to do that and providing people to have the social, provide and recommending social distancing and masking and all of that, but sort of slightly turning away, knowing that in this moment, protesting was just more fundamental, critical to people, and they were willing to take risks to speak up.
All right. I guess we can move on then. And another question that came in is, how have you taken students, and I guess I can kind of extrapolate this one to just general Berkeley residents as well, needs and feedback into your planning in the current situation?
We have students on, or we had students on some of the planning groups that, for example, the one on student services. I talk with the student leadership in the ASUC. So we're really trying to get, I mean, you're our students are the people that are really receiving the instruction. And so we very much need your input.
And
I would say from our side that we engaged really as quickly as we could with student leadership, ASUC and GA leadership, to help us design what we knew would be incomplete service delivery for some period of time as we kind of transition to a bit more video services, remote services. We had invaluable contributions from student groups, Berkeley Reserve Medical Corps, the kind of volunteers and students that helped man some of the testing sites. We had a call out to students and grad students in particular to help with our contact tracing. So really not only from a kind of an emergency response side, but from an emergency planning side, we've just had wonderful engagement with students. I'm trying to think of some other examples, but can't off the top of my head.
I just had regular conversations with student leadership, so that whether it's GA or the undergraduate groups, meeting with them regularly and just staying as involved as possible with the students.
And on the city side, I would say there's been a variety of, there are a variety of communication portals to the city, but I think the two of the main strategies have been that we conducted a series of listening sessions to community members, primarily oriented toward a variety of business industries and what they were struggling with and what they needed in order to get back up into business, and that has really informed our health officer orders and our guidance around reopening. And then our mayor in particular has conducted a series of town halls. In fact, our health officer is at his town hall tonight that I am not attending because I am here, where there's been a lot of community engagement about what's happening.
No, I would be remiss if I didn't kind of point out that the other group that we engaged heavily are the RAs, and they have a very, very difficult job. And, we listened in a lot of different ways to their experience during the first move-in testing, as well as the sequestration period for on-campus students. And they provided, well, I shouldn't use the past tense, they provide a tremendous amount of experience, not only from the student side, but again, from the RA point of view, which has been incredibly helpful. And that's in spite of some really, really challenging conditions.
All right. And I think we have time for a couple more questions here. So kind of on that topic of, relating to students, Jen asks, how has the return of some students to Berkeley impacted the city of Berkeley's emergency response?
Well, I think that it is some students. So compared to the normal population, I'm not sure what the number is, but I think it's maybe a tenth or something to that effect, maybe even less. Um, the city of Berkeley collaborated with the university around planning around that return. So we were, very much in communication, in collaboration, in design, checking with each other. And so we're very clear from the get-go what was going to happen. We have been involved in a little bit of the outbreaks that happen as a result of some off-campus exposures, but we've really come together around that, supported that. I will say that I heard today that on-campus living is the safest place you could be in the university right now. The university has done a fabulous job with their on-campus living circumstances, and I think that we have done that as part of sort of a collaborative planning. So, yeah.
I will knock on wood, but you're right that this really started, Noah, with a lot of communication to the city about our expectations as far as density and number of students that we expected, and that changed over time. We had one number in March or April, and that number changed and changed and changed again. So it really has been a lot of planning, and I know that's kind of the theme for this panel is kind of the emergency response planning, but it starts with regular and transparent communication. I think the other aspect, again, from where I sit, is that the lines between campus and city can get blurry, and it's in that blurred zone that I think most of the challenges arise. And I'm not saying we've gotten everything solved, but our team, the campus team, has really taken it upon ourselves to work with leaders in these blurred areas, the co-op system, the Greek housing system, to do as much as we can to not only normalize, kind of have this social norms campaign spread to all those areas, but also to offer testing, support them in their needs for clinical and psychological care. And to me, it speaks to kind of just the acknowledgement that there is this very gray and very blurry line, but it's in all of our best interests to work as a team to support these communities and these situations that can get missed at times and make risk a little bit, elevate the risk for not only the community but the campus.
We're working on something pretty cool still right now. We're working with the city of Berkeley on testing sites for sewage. And so by testing the sewage, you get a very early sense of where the virus might be cropping up. So we're working with the city to figure out where we can put that testing equipment, and it will give us great early information about what's happening in the community, not just on the campus, but potentially around the campus.
Yeah. And then I guess as kind of a last question tonight, it is a little bit open-ended, but what keeps you up at night when thinking about a future emergency?
That we're still in the present one.
or the response to the present one. I guess this is obviously a question from the audience, but just what is, on your mind right now is kind of the last thing to take away?
I actually was serious in that, it was one thing where we had we're getting better, slowly learning, managing COVID. Then suddenly we have the smoke. Then there's other things that can layer on top of that. And, we have the resources that we have. And so how are we going to prioritize and come together and, manage, additional layers of emergency or challenge that may come upon us? And there are some, real threats out there that we have to be mindful of and prepared for. And so, in the city of Berkeley, we're already sort of preparing you know, what's it going to be like if we're going to have, you know, multiple emergency operations at once, and how are we going to be able to come together to manage that, because that will be, you know, a big responsibility.
I agree with Lisa. It's multiple simultaneous crises in which the strategy to deal with one may not be the right strategy to deal with another that's happening at the same time. And you know, you have to become comfortable, as Guy said earlier, with making decisions in a state of really imperfect knowledge in which the facts on the ground keep changing, and making the wrong decision is something that keeps me up at night.
I think mine would probably, just building all that, would be an earthquake, because an earthquake takes a physical response. A whole team of us would have to come into the campus and evaluate the condition of the campus, which would be much more difficult wearing face coverings and all the other protective gear that we'd have to have. So I think things that, an event that pulled us together for a response would be, is much more complicated by this particular pandemic.
I'll just finish this out. I can't disagree with any of those concerns. I think I do see things a little bit differently in that one of the risks that we have is that this emergency, and I'm struggling to even call it that, because we're kind of, in one way, we're past an emergent response here, and this is more of a maintenance transition mode back to hopefully recovery. But I guess what you know, worries me a little bit is, as we start to understand this virus, what if we've been a little bit wrong, and this goes on longer than people are prepared for? You know, we're already, you know, months and months into this in the U.S., and you know, we see firsthand the struggle with mental and behavioral issues that seem to be kind of directly related to this. My other concern is, and this, I don't know, this is probably more indicative, you know, my own problem, but what if we get through this crisis and then an earthquake hits? So we've just made it out, and we're breathing this huge sigh of relief, and we're starting to try to figure out normal again, whatever the new normal is, and then we're back in, you know, plunged back into crisis. It seems to me that those are the kind of things that really you know, devastate people and communities, is when you feel like there's light at the end of the tunnel, you've hit the light, and then you're back in the tunnel. Wow, I don't want to end on a very dark note here. I hope there's another question.
Well, I guess maybe we have a few minutes. You guys want to maybe briefly share a positive takeaway from this whole situation, just since that was the request. I can kind of throw that in if you know, everyone just wants to maybe briefly share something positive to take away from perhaps the most recent emergency situation, or any that we've had in the past.
Well done, Noah.
Yeah, a long time ago, I wrote an essay on dystopian fiction. And what happens is mankind, you know, descends to, you know, a kind of very barbaric state. And what I've learned from an actual dystopian scenario that we're living in is how extraordinary people are. They're creative. They work with incredible dedication. I've just seen the community coming together in ways that inspire me every day. So that's one of my takeaways. And another is we're just learning so much.
I would say we're much better prepared for something in the future. I mean, we go through training drills in higher ed, and cities do this, but you know, you plan, but to actually go through scenarios like this, whether it's the smoke events, the power outages, or now COVID-19, all of these experiences make us much, much better at response in the future and being really well prepared for that. So we're also, I think, building a really great team, working together this closely over so many months. We all know each other much better than we did coming into this, just really quite beneficial.
And I'll go back to an earlier point that I guess being the mother of invention, we really needed to figure out new ways in some cases, and I keep pointing to the silver lining of our ability to do things in a different way, particularly with from where I sit, kind of remote and video, and using technology to supplant the in-person experience, whatever that in-person experience is. And I really think that that's going to be, you know, we're going to look back in 5 or 10 years or whatever and say, we're actually a little bit glad that it pushed us. You know, there's not to discount all the negative things that happened, but look at the positive. It really pushed us to kind of deliver instruction and care and other types of services in a way that can reach more people than we ever reached before.
I echo what Guy said. I mean, that's what came to mind for me too, was just innovation. But Guy said it so eloquently that I'm gonna piggyback off of his statement.
Right. Well, thank you so much once again to all of our speakers. It was really incredible to hear from you, at least for me, and I'm sure it was for everyone else in the audience tonight. So huge thank you to all of you for taking the time to come here. So with that being said, it's pretty much all of the time that we have tonight, and I will turn it back to our president, Cindy, for some closing remarks.
Thank you.
Thanks, Noah.
Thank you.
Awesome. Thank you so much to Noah for moderating tonight's panel, and to all of our speakers for partaking in this important conversation. So at all of our events, our communications team designs a custom poster for our speakers, and tonight's event is no exception. So here's our poster for tonight's event, and once we have the privilege of returning back to campus, we will be printing and framing and sending you each a copy of this poster.
That's great.
Thank you. But to the audience tonight, thank you all so much for coming. And if you have the time and ability, please fill out our feedback form so that we can continuously improve our events. And feel free to like us on Facebook, as well as visit our website to learn more about our upcoming events. Next week, we'll be hosting Ramtin Arablouei, who is one of the co-creators of NPR's podcast. And finally, if you're in a position where you're willing and able, we would love if you could support us and allow for us to continue to put on and host free events throughout this semester and in the future. But with all that being said, thank you so much again for coming out to tonight's edition of the Berkeley Forum, and we hope to see you again soon.